Modern life is stressful. We're juggling careers, family, finances, and nonstop to-do lists. And while stress may feel like it's just in your head, the truth is, it affects your hormones too. Chronic stress rewires your hormones. It drives hunger, fat storage, and even messes with your sleep and sex hormones. Hi, I'm Dr. Esra Shermadou, on board certified family medicine and obesity medicine physician. And today, we're breaking down how stress affects your hormones, your weight, and your overall health. And I'll share practical tips you can use to reset your stress response. Your body likes to live in a balanced harmony, or homeostasis. Stress disrupts homeostasis, and the body perceives this as a threat. This causes your body to shift into gear and pull together a whole set of responses in an effort to keep you alive and functioning, and back to homeostasis. Two main systems regulate our stress response. We have the HPA axis, or the hypothalamic pituitary axis, which is your hormonal stress pathway, and the autonomic nervous system, your fight or flight response. In short bursts, stress is good and the body can respond appropriately. But when stress is constant, it shifts from protective to harmful. Chronic stress disrupts your metabolism. It pushes fat towards your belly, raises blood sugar, and over time increases your risk for diabetes and heart disease. And here's what most people don't realize. Stress and obesity feed off each other. Stress can cause weight gain, but obesity itself creates a stress response in the body, which further throws your hormones out of balance. So, how does this all happen? Let's start with a quick rundown on the HPA axis. The HPA axis, which again stands for the hypothalamic pituitary adrenal axis, consists of our hypothalamus and our pituitary gland, both of which are in the brain, and our adrenal glands, which sit just above our kidneys. When you're stressed, your hypothalamus releases corticotropin-releasing hormone, or CRH. This tells your pituitary gland to release ACTH, which is another hormone. ACTH then signals to your adrenal glands to pump out cortisol, which is your main stress hormone. Normally, cortisol follows a rhythm. It peaks in the morning to wake you up and tapers down throughout the day so that at night it's low and you can rest. But when stress is constant, cortisol stays high all the time, and that's where the problems begin. Here's what happens when the HPA axis stays switched on. First, cortisol leads to insulin resistance. Cortisol causes blood sugar to rise. Cortisol also makes your cells less sensitive to insulin. That means that when insulin tries to move sugar from your blood into your muscles and fat cells, the cells don't respond as well. So your body pumps out even more insulin to try to keep up, but the sugar still lingers in your bloodstream. Over time, this pattern is what we call insulin resistance. And once that sets in, losing weight becomes much harder. Cortisol also increases belly fat storage. It drives fat straight to your belly area, what we call visceral fat. And visceral fat is inflammatory, which worsens your metabolic health. Stress increases ghrelin as well, and this is your hunger hormone. This makes you crave high-calorie comfort foods. At the same time, cortisol also blunts leptin, which is your satiety hormone. So even when you've eaten enough, your brain doesn't feel satisfied. And the result, more cravings, more belly fat, and a harder time keeping weight off. But it doesn't stop there. Stress affects your reproductive hormones too. In women, chronic stress lowers estrogen and progesterone, which can lead to irregular cycles, worsen perimenopausal symptoms, and even fertility struggles. In men, stress lowers testosterone, which can lead to fatigue, loss of muscle, and reduced libido. So, if you've ever felt like stress is draining your energy and throwing off your hormones, you're not wrong. It is. And then there's sleep. Like we mentioned earlier, normally cortisol is highest in the morning to help us wake up and trickles down throughout the day. When we have chronic stress, cortisol remains high all the time, even in the evening, which then makes it harder to fall asleep and stay asleep. Poor sleep itself raises cortisol, increases ghrelin, lowers leptin, and worsens insulin resistance. So stress and poor sleep reinforce each other in a cycle that impacts your hormones, your appetite, and your health. Here's the good news. You can't erase all stress, but you can train your body to handle it better. Here are a few ways to do this. Number 1, sleep. Aim for 7 to 9 hours. Even small improvements toward this goal can help lower cortisol. Number 2, move your body. Walk, lift weights, stretch. Even 10 minutes after meals helps. Number 3, practice mindfulness. Prayer, journaling, meditation, all of this can help lower your stress. Even 2 to 5 minutes can help reset your system. Number 4, box breathing. This sounds silly, but can really help decrease stress in the moment. To do this, you inhale for 4 seconds, hold for 4, exhale for 4, hold that for 4. Do this for a few rounds, and this can really calm your stress instantly. Number 5, practice progressive muscle relaxation. Make a fist, hold it for 5 seconds, and then release. Then move up to your shoulders. Shrug your shoulders up, hold that for 5 seconds, and then drop them. You can then move on to your shoulder blades. Squeeze your shoulder blades into a chair, hold that for 5 seconds, and then release. You can do this all the way down into your legs and into your toes too. This helps release some tension that you didn't even realize that you were holding. Number 6, build recovery into your day. Step outside for a few minutes, walk around the office, laugh with a friend. These simple things shift your body out of that fight or flight mode and back into balance. And number 7, make sure that you are eating a balanced diet. Meals with protein, fiber, and healthy fats. A stable blood sugar equals a calmer stress system. So the next time you feel stressed, remember, it's not just a mental load. Stress reshapes your hormones, affects your hunger, your sex hormones, your sleep, and even where your body stores fat. Pick 1 to 2 practical tips and start practicing them today. If you found this helpful, make sure that you hit subscribe and check out my other videos on hormones and metabolism. And make sure that you share this with a friend who needs to hear these tips too. And of course, if you're in the Dayton, Ohio area, make sure that you check out sakinahealth.com and join our priority list so you know that when we start accepting patients. That's it for now, and we'll see you next time.